Hello, I'm Solomay Tibabu, the host of the Going Digital Behavioral Health Tech Conference. I'm so excited to have Dr. Benders-Hadi here, the Medical Director of Behavioral Health at Doctor on Demand. Welcome.
Thanks so much. I'm so proud to be a part of this today.
Thanks so much. To get started, can you tell us a little bit about Doctor on Demand's behavioral health practice and with so much virtual behavioral health, what makes it different from many other offerings?
Sure. So yeah, Doctor on Demand is a leading telemedicine company. We offer total virtual care with 24/7 access to urgent care services, primary care medical services, but also behavioral health services delivered by our board certified psychiatrists, licensed psychologists, and master's level therapists. So we really enable patients to be able to connect to video-based visits from their computer or smartphone at a time and place that's convenient for them, and really engage in whole person care. I think what separates us is really our focus on our engagement. Right? We really have an employed provider model, which means, our providers are not simply providing a few hours of visits per month. They're really engaged in more part-time, full-time hours, which has direct impact on the patient care they're delivering. Right? When you're able to deliver on that longitudinal care, really know patients as individuals, that's going to have direct implications on outcomes, right? And the other thing is just our diversity. That's something I'm really proud of as well. I'd say that we employ what's arguably the most diverse virtual care practice in the nation. 43% of our doctors are non-white ethnic minorities, 20% are Black, over 60% are women, and even specific to our behavioral health practice, over 20% identify as LGBTQ+. So that's really important as it relates to things like health equity. We're really providing a provider base, right, that's representative of the population they're serving. And that becomes so important when, again, you're looking at outcomes, successful healthcare outcomes.
That's wonderful. Really great to hear. I had no idea. So, the combination of mental health and physical health has been an important theme at this conference. Can you talk a little bit about how that knowledge informed Doctor on Demand's design of your behavioral health practice?
Sure. Yeah, it's a great question. And the two are really closely entwined, right? The data's there also. We know that chronic medical conditions like diabetes and cancer are linked to higher rates of depression. We also know that individuals with co-occurring medical and behavioral health conditions have poor health outcomes and cost the healthcare system more money, right? So for another example, people with both diabetes and depression are 85% more likely to have a heart attack, right? So that in turn leads to more things like emergency room visits, hospital stays, follow-up cardiac care. So when you're able to, address both medical and behavioral health conditions together, you have better outcomes, right? Attention to this data becomes super important, and it's really the reason why we built Doctor on Demand as a truly integrated healthcare practice, where we're providing whole person care, right? Our aim is to really reduce the fragmentation and increase coordination amongst different providers, so that we're getting better outcomes. When you have access to affordable preventative care, right? Things like chronic conditions are much more likely to be discovered and managed sooner. And then that reduces the likelihood of progression past regular management to more severe conditions.
In your mind, what does true health integration look like, and why is virtual care uniquely positioned to deliver this?
Mm-hmm. Yeah, we know it's not simply enough to plop a behavioral health specialist in the middle of a primary care doctor's office, right? You also have to have navigation and access to the right level of care for that individual, right? I think that, virtual care is also uniquely positioned to deliver on this because of the ease of things like record sharing, how easily we can push things like depression assessments to patients, and easily track changes in those assessments over time. So I'm really proud that Dr. Demand is this virtual care provider with a truly integrated behavioral health practice. Specifically, what that means is that our providers are referring between the different practices. Medical providers are able to refer over to behavioral health and vice versa. We also provide training for our primary care physicians. We're cross-training them in behavioral health conditions, which allows those physicians to also do some initial screenings for depression and anxiety and stress. But also when they identify that a patient is in need of a higher level of care, able to refer over to a behavioral health provider. When you're talking to each other, when you can see all of the visit history and all the notes, that just makes it that much easier to get to the bottom of what's going on with that individual and get them feeling better faster.
Super helpful. Interesting. Now, I have to ask, tell me about the growth you've seen during COVID.
Gosh, over the last 12 months, we've seen an incredible need for mental health services. We're helping to solve for this demand, but just by continuing to make it easy and convenient to meet with a professional from our practice. What's remarkable is that, we've more than doubled our covered lives in the past year. We now are covering over 98 million lives, but we also have kept our wait times far below the national average. And we're even able to launch same day behavioral health visits with our providers in the last year, right? If you look at some of the data there, I think the average across the United States for getting access to a behavioral health specialist is around 25 days. But anecdotally, because I continue to see patients myself as well, anecdotally, it can be much longer than that. I see patients routinely that tell me that it's going to be 3 to 6 months before they're able to see a specialist in their community. So, again, looking closely at our data as far as our visit demand, we saw 140% year over year growth in 2020. So while there was more variability over the course of the year with medical visits, and that was more directly tied into COVID infection rates and hospitalizations, but we saw the demand for behavioral health visits really stay consistently high even today. So I think that really says something about the challenges we're all experiencing due to the pandemic, right? The adjustment, the grief, the loss, and even now the reintegration back into communities as we try to get back to some semblance of normalcy.
Can you talk about some of the challenges that the practice has encountered to keep up with this growth and really just manage in the face of the pandemic and how you've overcome them?
Sure. Yeah. So that's a lot of visit demand I was just talking about, right? So one major challenge we've had is how we scale our capacity to continue to meet the increased demand for behavioral health visits. So to do that, we really had to drill down deeply with our forecasting teams, our analytics teams, and really just to try to stay ahead of the curve. I think that was made easier by the fact that we have our employed provider model, right, which makes it pretty easy to lean into multi-state licensure, right? So in addition to hiring more behavioral health providers, we also were able to just get providers more licenses, which allowed us to redeploy capacity to areas that may have been seeing a shortage in times of intense demand. But we also invested in our recruitment teams, our rapid onboarding teams, doing things like consolidating our processes, adding to our technical liaison team and our clinical trainers in order to meet those capacity needs.
Yeah, can you talk about any other lessons learned from COVID on the mental health side?
Sure. Yeah. Keep in mind, I'm a psychiatrist, right? So I like to try to shift perspective from something that really has caused a lot of challenges, a lot of negativity, a lot of loss, right? But to sort of shift that perspective a bit into more positive outcomes, I think one, there really has been an acknowledgement now that mental health is as important as physical health, right? So one study out there showed that 3 in 4 Americans now consider their mental health as important as their physical health. Really, just that acknowledgement has got to be the first step to getting people access to the kinds of care that they need. I think the other thing is that COVID has really accelerated the adoption of virtual care models. It's just another option to access high quality care and achieve positive outcomes faster, right? I talked before about, more convenient access, no need to wait for months and months to see a behavioral health specialist. The other thing clinically, from a clinical perspective, an important lesson from COVID has been that resilience can be learned, right? We are all under so much stress right now. I've spent a lot of time talking to patients about what is normal, what's expected in the time of this kind of stress, when we're all really faced with a very real threat, right? It's not an imagined threat. It's not something, just in our head. We really are trying to stay healthy and safe. So to focus on resiliency as something that can be taught and can be learned is something that I think we've also seen over the last year. It has really been just another great outcome.
Absolutely. So, really exciting stats about the makeup of your workforce. And, I'll speak personally, finding a therapist of color on top of just any provider is challenging. Do you believe that practice diversity is tied to better patient outcomes? And how does Doctor on Demand prioritize this in your own practice?
Yeah, absolutely. I think they're directly tied to each other, diversity and better outcomes, right? Particularly in behavioral health care, when there's this need for patients to really open up, be honest, be vulnerable. When you're seeing a provider that looks like you, right, and is providing culturally competent care, that's going to impact your outcomes, right? Your engagement with them, how often you're making it to appointments. So Dr. Demand really prioritizes that, not only in our hiring practices, but also the kinds of cultural competency trainings, or in our product itself, right? In the Dr. Demand app, you're able to filter and find providers based on your gender preferences, your language preferences. If you're looking for a specific focus area, I think it really just highlights our commitment as a company to making sure that virtual care is not exacerbating health inequities in any way, as we focus on access for every community.
Wonderful. You recently launched coaching. Please tell us more about how you came to that decision and anything else we should know.
Sure. Yeah. So another exciting launch we've had recently, we really see behavioral health as being on a continuum. So while clinical services are provided with us through our psychiatrists and our therapists, we also saw the need to really shift perspective to thinking about behavioral health care as preventative as well, right? So that we're not just focused on illness, but on wellness as well. And not just waiting until symptoms are present and worsening, but intervening earlier in the process to ideally prevent that advancement to some more severe symptoms. We also have been really deliberate about the fact that we're not providing chat-based therapy, right? Some competitors out there have been called out for creating these blurred lines with licensing and state regulators. But we do acknowledge that evidence-based psychotherapies can't be provided by chat-based interactions alone. It's also true, though, that not every type of issue requires a clinical visit with a therapist or a psychiatrist. Really, the goal of coaching is to help with building of coping skills to address things like sleep disruptions, stress, communication difficulties, relationship challenges, burnout that we're seeing a lot of. So yeah, with our coaching offering, we're able to offer 24/7 access to chat-based care with coaches who are going to work with individuals on identifying those goals and driving personal accountability that's going to help in the long run.
That's an exciting evolution. And speaking of change, coming out of COVID, what do you envision for the future of digital behavioral health and its changes?
Yeah, so the technology continues to be disrupting healthcare in a very positive and exciting way. I think the field we're in is so exciting. It's such a great time to be here because there's so much good work to be done in terms of increasing access to care, no matter where the individual may be coming into you from, right? For the future, I think I really envision a continued curiosity about the behavioral health needs of different populations. And we've started to look at some of this data too. What are the needs of women, for example? What are the needs of essential workers or healthcare workers? Really continuing that curiosity and that research, I think, is going to be an important part of the future moving forward, but also continuing to be creative around the specific digital solutions that we're able to provide, right? So whether that's using artificial intelligence or more remote health monitoring or expansion of digital health tools. I think, it's also going to be important to be able to modify and adapt those tools more specifically for the individual, just because there's so many variable preferences, right, of how people enter the behavioral health space. Unfortunately, stigma still exists, right? So to be able to provide multiple access points that could adapt and change over time is going to be critically important. So, it's a really exciting time. We at Doctor in Demand are very excited. We have a new merger with Grand Rounds Health that we're excited about as well. And I think that, our new company is going to continue delivering on the high quality care and add to it just the navigation piece that's critically important for integrated medical and behavioral health care. So,
Super exciting. Historically, it seems like a lot of the telehealth providers were offering individual, single fee for service type of sessions. But as you talk a little bit more about this integrated model, it seems like there's quite a bit more to that. Can you explain?
absolutely. I think, again, specific to behavioral health care, there are so many different factors that go into what makes you, right? What makes you an individual. And when you have these one-off kind of medical interactions, it makes it just that much harder to get to the bottom of what those things are, right? When am able to, as a psychiatrist, ask you about your family, right? Sort of pull a family member into the session with us, right? That's going to really help in terms of understanding who you are, understanding when there's changes that are occurring, by being able to get that kind of feedback from other individuals that know you well. And so it's that longitudinal relationship that we really prioritize in our practice in order to get to these better healthcare outcomes. The other thing that I think is really interesting and has become much more highlighted in the last year is the focus on virtual care and its place in social determinants of health. So, again, by being able to be in the home with one of my patients, right, I can see their home environment. What does that look like? What does that sound like? If I'm working with my patient on weight loss, right, we're able to walk to their fridge, take a look at what their diet actually looks like. If someone's in therapy and dealing with anxiety, you're able to go on a walk, go on a walk with with your therapist in your hand, right? And those are the kinds of things that I think virtual care is really affording to help break down challenges associated with the social determinants of health and do it in a much more efficient way than you typically can in brick and mortar settings.
Given the evolving landscape, how is Doctor on Demand tracking the needs of individuals everywhere, evolving the behavioral health solution to fit those needs, and really tracking success?
Yeah, so that's a great question as well. I would say, unfortunately, right, there's so many challenges that we're dealing with right now. I don't see the prevalence of behavioral health conditions getting significantly better soon. I think, to first acknowledge that, and again, to be aligned with the resourcing and treatment options that are out there becomes a really important next step to be thinking about. Even for, things like our payers, right? When you're looking at claims data around behavioral health services, frequency of depression and anxiety diagnoses. That's only telling a small fraction of the story, because those are only the individuals that actually made it into care to be able to have that claims data available. So, again, I think by thinking about the needs on a continuum, by thinking about preventative behavioral health services to catch challenges early on is something that is critically important. And then even on the clinical end, with Doctor on Demand, we're doing a lot of tracking of clinical outcomes, right? So the PHQ-9 is a depression assessment that's been clinically validated and used for a very long time by behavioral health specialists just to tell the severity of symptoms of depression. So that assessment is something that we are pushing to patients ahead of every visit with us. We're tracking it in a graph form in our app, so it's very easy for a provider to see. Is there an uptick there? Is there a significant change that we need to be aware of? So that is flagged earlier on and allows that provider to make adaptations, changes to the treatment plan based on what that patient is reporting in real time.
It's really great to learn about all of the ways that Doctor on Demand is really meeting the needs of today's individuals and their behavioral health issues everywhere. Thank you so much, Dr. Benders-Hadi. This has been super insightful. Really appreciate your time and expertise.
It's my pleasure. Thank you so much for having me today.